Hello, my name is Savannah Thomas, and I will be presenting the research conducted on the challenges Thunder Bay City Police face when responding to mental health crises. The Thunder Bay City Police have considerable difficulties when addressing mental health concerns in the community. Because mental health crises are so complicated, it can be challenging for law enforcement officials to identify, comprehend, and handle such instances. There's a possibility that miscommunication and confrontation could worsen, which puts the officers and those with mental illnesses at risk. It is essential that these issues be resolved in order to protect community members' safety, dignity, and well-being, and to foster more respectful relationships and collaboration between law enforcement and the citizens they serve. Furthermore, the difficulties in treating mental health concerns are significant because they have a direct impact on individuals' well-being and the general dynamic amongst the community and law enforcement. In order to effectively address these concerns, it is necessary to develop proactive community outreach programs, collaborate with mental health specialists, and provide officers with specific training to improve their understanding and psychological concerns. Law enforcement create a more secure and encouraging atmosphere by emphasizing empathy, de-escalation tactics, and comprehensive approaches towards mental health. This will eventually foster respect as well as comprehension towards the community. In general, I will be discussing the common mental health concerns faced by the police force that has been done by Laura, the increases in mental health-related calls completed by myself, the challenges officers face when responding to mental health completed by Olivia, along with the solutions and improvements done by Andrew. In order to identify the most common mental health related concerns the police are facing, it is critical to understand the diverse interactions the police have towards people with mental illness. The first interaction, being calls for public safety concerns, consists of mental health apprehension, wellness checks, and PMI who have been reported missing in various circumstances. The second category, referring to crime prevention, requires officers to distinguish between PMI being victims or suspects when discussing crime prevention and responses. According to research, the most common mental health concern that police are called for are substance use disorder and threats of bodily harm. 1/4 of those PMI will require police involvement and expect intervention, which is a shocking statistic. PMI struggling with substance abuse disorder, including drug addiction and alcoholism, are often involved in the social justice system. In fact, they are among the most vulnerable to ending up in the vicious cycle of the broken system. With there being few long-term mental health facilities, police have little choice but to send them to places in which the PMI will likely get released shortly after. This leaves them vulnerable to homelessness, future encounters with the police, and ending up in legal troubles. Those with substance abuse issues are typically called in by bystanders due to public disturbance or concerns for safety. Once in the presence of police, intoxication increases the risk of noncompliance, violence, belligerence, and erratic behavior. As previously mentioned, the quarter PMI will require police involvement. Of those individuals, half of them will have been engaging in threats of self-harm and at times are already in the process of it. At times, PMI in crisis will call in themselves. However, more often, others concerned for the safety of a PMI will request a mental health check. According to Shore and colleagues, 55% resulted in the emergency transfer of the PMI to a mental health service or hospital. Similarly, when discussing the increase in mental health-related calls, the article by Anderson indicated that the Thunder Bay Police have received a notably higher number of calls concerning mental health, which highlights the growing need for crisis response programs. A vital participant in tackling the spike in incidents is Victoria Lane, a crisis response worker with specialization in managing mental health crisis in emergency rooms at a hospital. The difficulties Lane encountered highlights the significance of mobile crisis response teams. By meeting people where they're at, these teams seek to support people who are suffering a crisis with quick, focused treatment. This may possibly reduce the burden on law enforcement agencies and guarantee that those with mental health issues receive compassionate, appropriate care. The study also highlights how crisis intervention is changing and how experts like Lane must work together to develop collaborative strategies and effectively handle the intricate and rapidly expanding mental health issues within the community. In addition, the increasing number of mental health-related calls to Thunder Bay Police also highlights the critical role of First Nation police forces in ensuring the safety and well-being of Indigenous communities within Ontario, as outlined in the article Developing Mobile Crisis Response Teams. The study highlights the need for cultural knowledge in the formation of mobile crisis response teams. Recognizing Indigenous communities' distinct needs and perspectives is critical for the efficient deployment of crisis intervention teams, and this framework highlights the significance of including cultural understanding into the education and operation of such teams. This method attempts to improve crisis responders' awareness and responsiveness so that they can successfully handle difficulties with mental health within Indigenous communities in a respectful and cultural way. Moreover, the increase in mental health-related calls in Thunder Bay Police is closely tied to the link between substance use and crime, as shown in Cheverett's article Snapshot in Time. The research highlights a significant link between substance usage and criminal activity, particularly acts motivated by intoxication or the desire to support drug habits. This link highlights the difficult obstacles that law enforcement encounters when dealing with drug-related offenses. Furthermore, the article offers insight into prescription drug trafficking and its link to violent and property crimes. The combination of drug addiction and criminal behavior is a complicated challenge for Thunder Bay Police, needing comprehensive methods in addressing both the underlying causes of substance abuse along with the criminal behaviors that are driven by it. Likewise, according to Mary Ann's article, there is a close relationship between the increase in mental health-related calls in the Thunder Bay Police and attempts to prevent suicide in Indigenous communities. The study highlights the need for a holistic plan that takes into account healthcare, cultural, and economic factors in order to prevent suicide. Witnesses stress the critical necessity of addressing the larger social and cultural aspects that lead to mental health issues within Indigenous communities, as well as the critical need for better primary healthcare systems and locally accessible mental health treatments. The article's diverse techniques illustrates the difficulties in addressing the underlying causes of mental health crises, especially among Indigenous individuals. In addition, when focusing on the challenges police are facing due to the increase in mental health-related calls, we notice that there are a variety of challenges that collectively contribute to the difficulties officers face when responding to mental health situations. The lack of understanding about various mental health disorders may result in misinterpretation of behavior, potentially escalating situations. Similarly, the shortage of mental health professionals available to accompany officers during crisis responses hinders the delivery of appropriate care. Overall, addressing these issues is critical for improving crisis intervention outcomes and ensuring the well-being of both individuals in crisis and law enforcement officers. Moreover, in many regions, mental health services face chronic underfunding, resulting in a shortage of mental health professionals, facilities, and community resources. As mental health services struggle to meet the need of the community, officers increasingly find themselves handling a variety of mental health crises, ranging from individuals in acute distress to those with severe mental illnesses. This heightened demand places additional stress on officers and may contribute to challenges in effectively addressing complex situations. These situations requires ongoing efforts to dismantle stereotypes and enhance awareness about mental health issues within law enforcement agencies. In addition, legal and policy challenges underscore the importance of ongoing collaboration between law enforcement agencies, legal experts, mental health professionals, and policymakers. Efforts should focus on updating and clarifying existing laws and policies to ensure they align with best practices, respect individual rights, and provide clear guidance for officers facing complex mental health crises. Reforms may include the development of crisis intervention models and legal frameworks that prioritize de-escalation, protection of individual rights, and collaboration with mental health services. With the absence of sufficient funding for mental health institutions, there is a critical gap in long-term mental health care. The limited availability of these services means individuals with mental health-related issues may not have access to the specialized and sustained care they require. This gap can result in a higher reliance on emergency services, including law enforcement and crisis intervention. The fact that only about half of Canadians with mental health-related disorders receive professional help underscores the systematic issue in accessibility. Addressing these challenges requires a comprehensive approach involving not only law enforcement, but also coordinated efforts from mental health services, policymakers, and the community. Moving forward, a big part of the problem in policing those with mental health is the fact that much of the solutions proposed are not implemented or accepted on a large enough scale. The police are typically the first and often the sole community resource called on the response to urgent situations involving persons with mental illness. A lot of the problem and direct solution deals with the communication and collaboration between police organizations and mental health services. It is critical that police and mental health departments collaborate, and that neither the mental health system nor the law enforcement system can manage mental health crises in the community effectively without the help of others. The question in hand is, what are viable solutions? The fact that the matter is referring people to appropriate mental health resources and following up on progress takes time and resources, and the police don't always have. Some of the solutions to this is providing police with higher quality mental health training, such as crisis intervention training. Crisis intervention training is where psychologists and other clinicians train police officers on determining mental illnesses, applying appropriate de-escalation skills and triage. This leads to less focus on criminalization and incarceration of those with mental health. Another viable solution is the implementation of co-response teams in street triage. This can best be explained as the implementation of mental health expertise when the police interact with individuals dealing with mental health. This results in a greater emphasis on getting people help in treating the problem. What this looks like for police and society is as follows. The use of both the co-response method and crisis intervention training led to a major improvement in discretion and a large decrease in criminalization, while also benefiting cost savings. When using these methods, such as the crisis response team and co-response team, the costs associated with responding to mental health calls dropped. With the average cost per crisis response team calculated to be 23% lower in the introduction of the triage program due to a reduction in hospitalization. Another major benefit through these advancements was that police officers also spent nearly 20% less time on each mental health call, supporting an improvement in communication, empathy, de-escalation, and knowledge of appropriate situations. Higher quality mental health training on crisis response and street triage led to police officers self-reporting a 23% increase in confidence when interacting with individuals in psychiatric distress, which over a 6-month period led to over $80,000 in cost savings. Overall, these advancements and adoptions of crisis training, street triage, co-response, and crisis response teams have led the police to be better equipped mentally when dealing with mental health, allowing for these individuals to truly receive help. That concludes our presentation, and the next few slides present all of our references. Thank you all for listening.